Hi everyone, Dr. Eisenbach here with Internal Medicine. Here to talk to you today a little bit about thyroid disorders, which is something we encounter in the clinic pretty regularly. So let's jump right into it. There are two forms of thyroid disorders that we look at in the clinic. One is hypothyroidism, a decrease in the amount of thyroid hormone that you have in your body, and hyperthyroidism, or an overproduction of the thyroid hormone that you have in the body. Now, the most common form of hypo, or underproduction of thyroid hormone, is a condition called Hashimoto's thyroiditis. Most common in women, less common in men. Middle-aged women usually get this condition. It's a result of antibodies that form to the thyroid. We're not sure exactly why, but your body essentially makes these antibodies, they attach to the thyroid, and your immune system goes and eats at the thyroid and destroys it, stopping the production of thyroid hormone. If the thyroid stops working, that means your thyroid hormone in the blood goes down. Then the pituitary gland says, oh, there's not enough thyroid hormone. I need to stimulate the thyroid to tell it to make more. So a hormone called thyroid stimulating hormone, or TSH, goes really high up in the blood. Symptoms: fatigue, constipation, weight gain, edema of the face, dry skin, hair falling out. These things, they're all underproduction essentially. And the thyroid is responsible for metabolism, so that makes sense. When you have not enough thyroid hormone, your metabolism goes down, you gain weight. Let's go to hyperthyroidism really quickly. The most common form of hypothyroidism, or disease associated with it, is called Graves' disease. Autoantibodies are made, just like in Hashimoto's, but these antibodies stick to stimulating proteins on the outside of the thyroid. And it makes more hormone, causes it to increase hormone production. So we have too much T3 and T4 in the blood. Because we have increased metabolism hormone, we're going to have things like diarrhea, weight loss, sweating, high heart rate or palpitations, increase in blood pressure, osteoporosis. With low thyroid or Hashimoto's, most often we treat with levothyroxine or Synthroid, which is the synthetic version of our natural hormone. So we give the body the hormone it needs, and those symptoms should abate. If we have too much thyroid, it's a little bit more complicated. Usually the treatment is either removal of the thyroid gland via surgery, or more commonly, we give the patient iodine that's radioactive that goes to the thyroid and shuts it down, basically destroys the thyroid. So, that's the overview of thyroid disorders. Again, I'm Dr. Eisenbach. Thanks so much for listening to me. If you have any questions, concerns, thoughts, if you're experiencing any of these symptoms, please give us a call. We'd be glad to visit with you about it.